Welcome to Podcast on TechNation. This is a new series of podcasts focused specifically on the biomedical and HTM industry. Episodes will be added monthly. Listening to each episode is eligible for 1 CE credit from the ACI. At the conclusion of this episode, you will be able to access a link that will take you to a quick survey. You will be able to download your certificate once you submit the survey. Before we begin today's podcast, I'd like to invite you to save the date for our upcoming MD Expo in Tampa, Florida, November 8th and 9th, and our last HTM Mixer of 2020 in Nashville, Tennessee, which will take place on December 9th and 10th. You can find out more about these shows at mdexposhow.com and htmmixer.com. In this episode, Al Gresch, Vice President of Healthcare Strategy, Accruent, and Mike Zimmer, Senior Solutions Engineer of Accruent, sit down with Mike Finnegan, Executive Vice President of Sales and Marketing at XL Medical, to discuss how to sharpen your persuasion skills and articulate value to your internal leadership team and secure funding for new ideas and initiatives.
Good morning, Al. Happy Thursday. How are you doing over there?
Thanks, Mike. Oh, I'm doing fantastic. Another day in paradise, my friend.
Awesome. You're living the dream, as we like to say.
Always.
Awesome. So it's great to have another episode for us to actually take some time out of. I've actually seen both of our calendars. They're quite swollen. They're a little bit bloated. And we can just connect about a topic that we want to talk about. And today's topic is pretty fascinating, in my opinion. It's one that I've got a bunch of background and history with, as does our guest. Speaking of which, that was a very graceful segue. Al, who do we have on the podcast with us today?
Well, Mike, today I've got a close friend of mine, Mike Finnegan. Mike is the Executive Vice President of Sales and Marketing at XL Medical. Has been the Chief Strategy and Sales Officer at Consumer Health Connections. And where I really got to know Mike is when we worked together when Mike was with GE and I was at Aurora Healthcare. He held several roles, including commercial GM, senior client exec, even worked at Draeger for a while selling anesthesia machines. But as Mike said to me at one point in time, he's never sold a box. He's always sold solutions. And so welcome. Thanks for joining us this morning, Mike.
Well, thanks, guys. I appreciate your time.
Mike, you want to tell us just a little bit about what your current role is at XL Medical? And
just, I've been with XL since, for the past 3 years. I had a small stint in the consumer health telehealth market and joined that team about 3 years ago. XL Medical is, I guess I'd call them at the very forefront, device integrator, specifically patient monitoring and third-party devices. We do a lot of integrations to the EMRs out there. We float a little bit into alert and alarm management and predictive analytics. So they're a dynamic organization with a ton of value out there. I think that device integration is an animal. Meaningful use was probably the initiation of device integration. And the past 10 to 15 years, organizations have scrambled in and around it. And I think we're really kind of focused now on unwinding that to establish more value in the integration at less cost. And I've been, working with their leadership and their commercial organization for the past 3.5 years or so.
Thanks again for joining us this morning.
Yep.
And so we're going to leverage the other Mike's expertise in the following area. So let's go ahead and title this episode. And it should be titled, The Importance of Good Salesmanship. Now, this isn't a sales podcast. If anything, we try to avoid commercial aspects on this podcast. Like, I hesitate to use the word plague because of the times we're currently living in. But what we're going to do here is take all the skills, all the practices of a good sales professional and internalize them. So how do we equip, or how can you equip yourself to better internally sell? And Al, you had actually written an article about 10 years ago. It goes through 10 different steps foundational building blocks to really increase the ability with which you can move your initiative through an organization and get approval from the various stakeholders, et cetera. So I was thinking about structuring this conversation based on that article. So Al, anything you wanted to add to that preamble prior to us digging right in?
Just that interesting. I started out my career as a technician. Often said that I could never be a salesperson. Didn't want to be a salesperson, but the reality is that every time you interview for a job, you're selling yourself. And any time that you want to pitch an idea to your leadership, and quite frankly, even to your wife or your kids, you're a seller, right?
Right.
You're a professional persuader, what I refer to it as in the article. But it is an important skill. It's a skill that I think everyone needs to hone. And so many people in our industry know what needs to be done, that knows what opportunities are out there, but really don't know how to pitch it and be successful at convincing others that it's something that's important to do.
And so, Mike, why is this an opportune time for someone to take a skill set like internal selling and start to hone it, start to sharpen the saw around that?
I think the problems in the marketplace are presenting all kinds of opportunities. Like Al said, I think it really comes down to the basics. It is, first of all, your image, not only your own personal image, but also what you're representing and who you're representing as an organization. I always have said this, that 90% of the sales people out there make the 10% that are really good look really bad sometimes, just because their inability to pay attention to detail. Everybody's always trying to sell something, as opposed to something I've always tried to live by is help people get what they need to make their job easier, more valuable. I just think the dynamics of the marketplace, the COVID circumstances, and being a lot better on camera, being sharp, doing your research. I don't think there's ever been a more opportunistic time for solution selling, to be honest with you.
Yeah, and then given the financial or budgetary pressures that a lot of our customers are under, all these initiatives are going to be competing against each other to get funded.
They are.
So you should really sharpen your skill set in order to compete, unfortunately, against other teams that you've got within the four walls of your healthcare system. It's crucial at this time for you to be able to articulate the value of the initiative that you're proposing to the people that are going to eventually write the check. Let's get tactical. So there's 10 bulleted items here. All of them are again, pretty foundational, but there are little details, I don't want to call them tricks of the trade, but there's ways of optimizing the leveraging of each one of the things we're going to talk about that hopefully, Mike and Al, given your experience over the past 137 years or whatever it might be, you'll be able to fill out these various bullet points. And the first one is pretty crucial, and it's having a product worth selling. So Al, take us through a little bit about what you mean by that in this article that you wrote.
The article was around selling ideas. You're often in a position where you have to sell even something as simple as getting the right amount of staff. If what you're delivering is bringing crucial value to the organization, it makes it much more easy to sell. You're bringing savings, and Mike talked about this being an opportune time. I'll tell you right now, there isn't anything more important to a CFO than reducing the bottom line, because the industry is hemorrhaging dollars. And those are things that really resonate. And I think that's true if you're selling solutions as well, any solution. I think to Mike's earlier point, no one likes to be sold to. Everyone likes to hear about solutions that are going to solve their big problems.
Another t-shirt idea,
right?
for us to get made. And, it's good that this is the first one, because if I'm given 6 hours to chop down a tree, I'm going to spend the first 5 sharpening the axe. And so when you really understand what kind of value your idea or whatever it might be is going to bring to whom you're going to effectively sell it to, you're right. That makes everything quite a bit easier. And I'm sure that's been your experience out in the market, Mike, right?
Well, I think the ability to establish value up front is imperative. It used to be that you had 18 months to 3 years or whatever to develop this relationship over dinners and whatnot with potential clients. That is shrunk to a meeting. You need to be able to articulate your value fast, which requires any individual to understand what the problem is you're trying to solve for that particular client. It all stems back to where the hemorrhage is at financially, or potentially where patient safety plays in. But you need to be able to zone in on that, immediately establish the value, have an exchange about it, and move forward. That is a crucial element of commercial success.
Yeah, and every component of you positioning a solution needs to pass through that prism effectively.
Absolutely.
Anything else is extraneous, and you're frankly wasting the audience's time.
I really agree with you. I sit on some of these things these days where you go around and introduce 15 people, on this remote. It's, hey, look, do your research. If you have to rip off a few names on who's participating, great. The client doesn't have time. They are busy. Be respectful of them and their circumstances and get in and get going.
Exactly.
That's the point I often make. Many, many years ago, I attended a class on communication. And in that, they talked about communicating to executives. And the point that they really drove home was to summarize the summary, because, like you say, Mike, they just don't have time.
They don't. And when you start a meeting the way we were just kind of talking about, it's indicative of what you don't know. That number one, they don't have a lot of time. I can think of far more meetings with executives that started out that way. Let's do introductions, where by the second person, the executive interrupted and said, let's just get right at it. Very politely, very diplomatically, but that's how the ball rolls today. You have to have a very well understanding of that, for sure.
Mm-hmm. Man, I'm taking that down as a piece of feedback to deliver to some folks that I know. And we understand that we need to have a product, an idea, a solution that's worth selling, and that's going to deliver some value. Otherwise, why the heck are we even having a conversation? Let's move on to the second bullet, and that's be committed. Now, this should almost go without saying, but yeah, I think it's an important thing for you to be actually committed to the solution that you're positioning to your organization. Al, can you think of where this isn't the case? What would happen if you were a taciturn commitment level on something that you're trying to accomplish as a team?
I can provide many examples. One that comes to mind is when I was selling an idea to the CEO at St. Luke's Hospital. She said at the end of my intro discussion that she could clearly see the passion that I had around this, and it helped her believe in it. And I think that's really the crux of it, that if you don't believe in it yourself, right, how do you expect anybody else to believe in it? And you need to bring that passion because it comes across. I bet you see that all the time, don't you, Mike?
You can't fake committed.
That's true.
You can't do it. And if you don't believe in it, I've been fortunate enough in my career to represent a number of different technologies that were the absolute leaders in the marketplace, all the way back to Draeger at that time, to Marquette Medical, and then on into other things that I've done. You just can't fake that. Committed comes from your understanding of what you're representing, of the marketplace, of the circumstances of the client you're talking to. I've been complimented more than not on passion. I really appreciate that. Passion really is the commitment that I have that whatever we're talking about is going to deliver the value that I'm telling you it will. Committed and passion are follow-up. Committed and passion are being there before the meeting starts, being prepared. Those are all, the solution itself goes without saying, it better be valuable. Commitment is something you create as a commercial person, and it's all about your image and your willingness to make success happen based on what you're doing.
And in my experience, that commitment, that passion can also assist you if there's a gap or a hole in other components of your game. So oftentimes I get asked questions where I just flat out don't know the answer. It's going to happen. I can't know everything, thank goodness. But if I show that passion for what we're trying to do within the market and intellectual curiosity, man, you have the potential of building a relationship with that customer versus, I don't really know the answer to that. And you telegraph the fact that you don't really care, that you don't know the answer or whatever it might be. And it's about bringing, so I think we could also say commitment equals passion in this case. And you can talk value all day, and that's extremely important. That's why it's the first bullet. but there's also a subjective component to what we're trying to accomplish here.
Yeah, I agree. It's interesting too. You can take that commitment and passion too far. I've seen a lot of people not know when to stop, and that taints you for the next opportunity. I'm big on it and within the diplomatic parameters that it stands for, and it's a big part of absolute relationship success for sure.
Yeah, you don't want to say you'd be an idiot if you don't buy what I have.
I've seen people edge right up next to that.
Yeah, let's try to avoid that dynamic there. So I kind of feel like number 3 is a table stake kind of thing. It's be polished.
Mike, I did a presentation at a recent biomedical conference here in Milwaukee. The topic was messaging to the C-suite, and that was one of the things that I brought up. If you want people to respect you and look at you as a professional, don't walk into your CFO's office wearing a polo shirt and Dockers. Don't do it.
What's very interesting, Al, is I've seen some of the guys wear the fanciest suits in the world and be the most unpolished people I've ever seen. I think you're absolutely right. Your image is everything. But the thing about working with the executive level is you're never comfortable. You sit up straight, your arms are on that table at any moment in time, and I've seen numerous executives do it. You relax into your chair and he shoots or she shoots a zinger across the table and you're caught flat-footed. That is not being polished. Even if, to Mike's earlier point, you don't know the answer, when you're at attention, when you're completely committed to the topic that's being discussed and you don't know the answer, it's acceptable. When you slough off or you grab that cell phone for a moment, Al, you know, I've had multiple executive account roles where I was over, the entire portfolio of technology that whatever company represented. It's always interesting. Everybody wants to get to the executive level. They get there, they don't know what to say. Or more importantly, and honestly, Al, more embarrassing, they don't know how to act. I can recall a specific time I worked months to pull this executive level meeting together. I got 12 or so people in there from our organization. 11 of them didn't know how to act in that environment. It was nerves. It's not anything personal on them, but they're never there. Polished is multiple things. It's important based on the intense schedules that these executives have and the things that they have on their mind while they're even talking to you. So it's just polished to me, Al, is just absolute respect.
I think it goes back to the topic of preparation as well. The more prepared you are walking in, the less likely you are to stumble when you get there.
It's actually an implicit test that you're submitting yourself to without you even knowing. I think in your article, you put it really nicely, Al. You say it's easier to start off being seen as a consummate professional and then being taken down from there over the course of the meeting versus starting at the bottom and then trying to work your way up to being seen as someone like that. That goes back to polish too, and it goes back to prep. So I'm happy you brought that up because it is, and I get into this situation quite a bit. I don't want to have to rehearse. There's a component of my brain that says, I know what I'm doing. I've had a million of these meetings. You have to commit to that. It's almost as if you're a professional athlete and you have to watch game film and you have to practice because to your point earlier, when you've got what the baseline conversation is going to be, riffing or improvising on the top of that is that much easier and you're still in the zone versus not having that be the case and where you get just absolutely, that zinger comes across the table and you're flat-footed. It's important.
It's very important. I think, Mike, it's just laziness. When we get ready for a meeting that I'm in command of for an executive, the prep is extremely intense to the point where the night before I'll lay down in my office, close my eyes and play every scenario through my head. And it will show in that meeting. Right. I remember reading about Tiger Woods, who was in a championship of some sort. There was 90 minutes between matches. The other guy and his wife went and wandered around the golf village or whatever. Tiger laid down on a couch in the locker room and played every hole. That's what it takes. To your point, Mike, professional athlete. I think Michael Jordan's an incredible basketball player. I don't think he can do what I do. If you carry that type of confidence and preparation, you'll be successful. It's about respecting who you're dealing with and who you're representing for sure.
Yep.
And developing muscle memory.
But muscle memory, prep, being polished, crucial. All right. So bullet number 4, do your homework. I'll talk to that a little bit.
Well, I think we touched on it quite a bit already, Mike, and it's know your solution inside and out. Know the pain is that this particular person is feeling, and how what you are bringing to the table will solve that. Know that inside and out. Have statistics to back you up whenever possible.
Yeah, I think you're right on, Al. I mean, the other thing is, in some of the technologies that we represent now, you may think you're ready to sit down with the CIO or the CFO, and you're not. You need to do an enormous amount of preclinical and technical assessing in that particular environment before you're ready to sit down. And a lot of times, Al, I think that's what made our relationship so successful is you gave me the time to do that. We equipped with that information enables us to recite that client's circumstances to them, not in a embarrassing way, in a very diplomatic way. These are the problems we observe that you have. This is how we think our technology can address them, and this is the amount of time we think it will take. The features and benefits element of sales at the executive level is a waste of time. This is about, they want to understand how you're going to solve their problem, not the button that's going to solve the problem. Mike, you said it when we kind of started this conversation. In a lot of ways, the clients themselves need to be educated. Everybody wants a proposal, but you can't hardly give you a proposal unless, at least in my world, until I know what I'm trying to solve for. And understanding what that problem is, because you've seen one hospital in my world. Those pre-assessment exercises are, activities that are intended to make a sit down with any executive suite. It's interesting, you're on when you've got a 30-minute schedule, a 30-minute meeting scheduled, and you look up at the clock and you're in there an hour. You've established that you have something incredibly valuable. But I think what's even more telling, guys, is that for 40 out of the 60 minutes you were in there, the client was talking amongst themselves about how to apply the technology to solve their problem. I'm not saying a word. It's all these little details that you work toward to ensure you're taking the utmost advantage of their time.
And that goes back to your homework, because the value of what you're delivering, and this applies to any idea that you have internally to your department, the value is going to be different based on the level, the hierarchy that you're communicating with. And so I see this all the time because my job is very tactical during these meetings where I present the software. And so I have to define the value from a tactical, operational, and then like a strategic level. When we get into a conversation with somebody in the C-suite, I know that we've done a great job if we stay on like a single screen. It's more a conversation in the room about, well, this is terrific. They've already proved out their credibility and value. Now let's start talking about how we effectively deploy this technology.
I can't tell you guys the number of times that I've been in meetings at that level where the person in charge of presenting will tell the group, hey, come on, hold your questions. I need to get through the deck. And you're in with the wrong people at that point in time. Yeah. Because our strategy is inverse to that. It is less is better. The value conversation is the winner.
The interesting thing too, and you touched on this briefly, Mike, that sometimes the folks that you're talking to, they don't understand how stupid certain things are because it's become the norm, right? And I always think back to the pitch that I did at one of our major hospitals around getting a handle on pump utilization. The fact that it's accepted in our industry that 40% utilization is what it is ridiculous. Think about that. 40%, less than half of the time the thing's sitting there is being used on a patient. And Mike, I always think back to one of our times together where we were sitting in a boardroom with executives, and one of them jumped up and said, we can do this ourselves. And the CEO said, if we could do this ourselves, we would have done it ourselves. So whether it's lack of knowledge or lack of bandwidth.
You are so right, Al. That is funny. I remember that meeting. I do.
You're not going to be able to challenge those kinds of paradigms without first doing your homework, right? You have to know all the background information in order to push back against something like that. So number 5 kind of dovetails right into this. This is a component of homework, and that's knowing your audience and what's important to them. So defining what the WIFM is. What's in it for me?
I don't know where I learned it. Maybe it was innate, but it was reemphasized to me multiple times throughout different sales training classes that I've attended, that it's just not about me, it's about the customer. And as long as that's front and center on your mind, you can quickly tell when it's not, because they'll go right to feature and benefit, and they'll start talking about we and us. We can do this and we can do that, and you've lost them. You've lost them because we doesn't matter. And to your point about knowing your audience, in today's dynamic, it is intensified 100%. And the tools that we have to enable us to know the audience are really pretty convenient. LinkedIn, Google, even different articles that they've written. When Mike Zimmer says something in a meeting, you're in there for 55 minutes and Mike is the main person. He doesn't say anything till the 53rd minute. You got to be able to capitalize on it. Well, thank you, Mike. I appreciate that. I know you wrote an article on device integration and some of the struggles that you're having. This is how we approach them collectively, collaboratively. There's just so many different conversations that you can have to make that impact. It's not about me.
So what's in it for the individuals there?
You can be pitching the exact same initiative to different people, but the message has to resonate with that group. There were so many things that when I was pitching it to the CFO, what I focused on was the monetary value that it was going to have, how it was going to impact the bottom line. When I talked to nursing executives, again, the exact same initiative, but for them, I focused on the impact on patient care, staff throughput, things like that.
Absolutely.
Totally agree. Let's now move over into bullet number 6, and that's to tap into available sales training resources. Now, much like there are good salespeople, and then there are the bad ones that become stereotypes in the TV and movie versions of salespeople that we see, there are great sales resources, and there are also terrible ones. So, Mike, I'm sure you've got quite a bit of experience working with these kinds of resources. So is there a particular book that you would recommend to the folks listening to this?
I've been through a lot of them, Mike and Al. The one that really has always sort of defined everything we do, and I think it applied then and it applies now, is the Challenger Sale.
I was going to recommend that one too. That's awesome.
Hey, look, it's just common sense. It's just basic common sense. But I also think that, the one that I used to really lean into and followed for so long, a guy, he always had an article in the weekend section of the Business Journal, Al. I think his name was Jeffrey Gitmore. And he was a sales guy. And he just made so much sense. So I would always lean into every article that he wrote and even look him up. Today, I think, like on LinkedIn, there's a guy, I forget his name, it's called The Brutal Truth. And, this guy is just so common sense. But I think, and I've been through a number of different types of trainings, etc., some good, some bad, radar selling, Miller Hyman, all the normal ones. But really the one, and it's sitting on my bookshelf here, is the Challenger Sale. And, in fact, at XL Medical, even before I got there, those guys did a complete deep dive off of that book on how to, approach their market, and the types of information that they gleaned from the Challenger Sale was very successful for them. I'm really big on that one, Mike.
Yeah, same here. The narrative of that book passes through is 2008, had our housing crisis, but there were still these top performing salespeople across a bunch of different industries that were continuing to do extremely well. So they dug into the performance of those individuals to identify the behaviors of what caused them to still have success. I think that's really appropriate for right now too, given what the healthcare industry is facing. Again, it's about humans interacting with humans. One has a solution that's going to deliver value. and the other one needs to have that value articulated to them so that there's a fair exchange of value too. And it should go without saying that this article is going to be made available once we publish the podcast. All right, so number 7 is actually one that I'm super passionate about for obvious reasons, and that is familiarize yourself with presentation tools. Your PowerPoint deck, whatever it might be, is not what you're there to discuss. It is simply a tool that you can leverage to support the overall conversation around value. We get into situations where it is death by slides. Still in 2020, I'll have to sit through a meeting where there's 15 slides before we even get to what the customer cares about. Feedback abounds after those sorts of sessions, but if you take the time to really take a course on something like PowerPoint or Visio or even Excel, if you're wanting to present information through that tool during a presentation, definitely do it. Because if you don't, someone else's initiative or idea is just going to come in and clobber you. It might not even offer as much value to your overall organization as your idea does, but the devil's in the details, and those details have to be how you present, how you leverage the different tools during a meeting as you present them. And if I could just give like a really good rule of thumb, take a look at one of those Apple press releases or Apple presentations when they bring out a new product. They build engagement and anticipation around what they're about to pull out and display to everybody, which is most likely really just an iteration on something that they've previously released. So take a look at one of those and try to model the way that you leverage these tools in a way that's similar to the way that Apple does it.
There was a time in my life that I was deathly afraid of getting in front of people. And I decided I either was going to run from it, which has to be running like from a grizzly bear, or figure out how to get good at it. So I went through a number of different presentation skills things. This is years ago in my career. And I finally came upon this one called Communispond. And I actually ended up going through that exercise 3 different times over the course of my career. It's not about what you say, it's how you say it, right? In today's world, the people that we're talking to only will retain about 10% of what you say. So you need to make sure that within the 10% every time, 4 or 5 times your discussion, your conversation, you're referring to the 10%. There's a number of different ways to do that. I think the interactive pens that are available now for the Surface Pros and even this computer that I'm talking on allows you to engage the audience, circle things. I really like the whiteboards these days. You can put right up there, what do you think about it, Mike? And write it down. It becomes your notes that you play back and you're responsive. There's never, ever been a more important time to be good at using visual tools in presentation skills, Mike, than now, ever.
Especially given the remote nature of how these presentations are getting shared. And you brought up a good point. I went right to the software, right to the actual tools that you'll leverage during presentation. Occupational hazard, given my job, I think. But there's so many great organizations out there that can help you sharpen the skills, or the saw around how do you actually articulate your message. So I was kind of in your boat when first getting up in front of these really seasoned senior people. I make jokes when I get nervous. And so I would do that all the time. And I also thought that, there's one way of communicating to the C-suite. And that's what I really have to align to. But at the end of the day, you're going to be who you are. So if you're hearing this and you're like, well, I don't want to be 100% buttoned up and super polished, you need to pull your personality up into the way that you communicate with these audiences, because otherwise it comes across as stilted, and your passion, your commitment to this isn't going to be transmitted by the way that you behave.
It's at risk. So interesting. This particular analogy, there are third basemen that can go out and take 2 or 3 grounders and play in a National League game and never make an error. I need to take 200 or 300. Okay, that's me. That's what I know about me, is that the more I know, the more times I've taken that ball and whipped it to first base, the more comfortable I am and confident I am in myself. But that's just my rule of thumb. I work with a guy who is just a phenomenal dude in the executive suite. I mean, he just is. He does very little preparation. He's the guy that can take 2 or 3. I need to take 200 or 300.
Yeah, so it's about who you are as an individual. And
it is.
Okay,
it totally
is. I got
it.
Al, did you have anything to add to this conversation around familiarizing yourself with presentation tools?
Well, I think be minimalistic. is always my recommendation. And I've learned this over time too. You see so many slides that are busy as heck, and how do you get to the point that you're trying to make? It should be a guide, right? It should do nothing more than to spark a topic that you can then expand on. And the other thing that I've seen is a lot of these tools have cute little gadgets, animations that you can plug in. Don't do it. Don't do it, because it's a distraction.
Because your audiences, our brains have novelty bias, so they like seeing things that are a little bit different from slide to slide or something like that. But you're right, it can become a distraction. And
I think that's a good convo though, guys. I was never a big fan of build, but build allows you to control attention. You shouldn't have 15 builds, it should be 3. And so you float in that I think Al's a great guy. And you're focused on that, you talk about it, then you float in, I think Mike's a good guy, right? And so the audience is clued in to the points that you're making. The brain works so fast, it gets ahead of itself. But if you can control the build, you can to some degree just keep attention. That's really, I think, the focus. So I agree with Al, minimize things, but be prudent in how you use these things. There's nothing more valuable than appropriate 30-second story that relates to an example of how you worked with XYZ, or a quick number play. Just tell me what you think this number represents, 102 or whatever.
Right.
That keeps attention. So yeah, there's a lot to be said for all of it, for sure.
Well, I think the most powerful presentation tool ever, period, full stop, period, is storytelling. Having a narrative, having a story that you can articulate or position your idea or solution with is crucial, because that is the way that cognitively we are wired to consume information. We like to think we're super sophisticated and technologically advanced, and we are for the most part, but we're still working with the same brain that spent thousands of years around a fire in a cave, telling stories to one another.
Mike, what's interesting about in this world of multitasking and maintaining attention, you can say a number of different things during a presentation or discussion. Just try this. When you say, I want to tell you a quick story, almost 100% of the time, 100% of the people will stop what they're doing and look at you. That's how we communicate. We tell stories. Just try it. Just try it. Say, I want to tell you a quick story, and see what the people around the table will do. They'll stop what they're doing and they'll look up and listen to your story. Now that doesn't mean you go into a 7-minute diatribe. It is a 30-second quick hitter that has value around it, that is applicable to the conversation, and you move on. So reminding ourselves that you've got to be unique, you have to be different, you have to be valuable, you have to be relevant.
Bullet number 8 is be persistent.
I talk about how you have to have the right message at the right time. You may present something that for whatever reason it didn't fly. Figure out why it didn't fly. Figure out if it was the wrong message. Figure out if it was the wrong set of ears that you were sending the message to. But don't give up. Over the years, there's so many things that I was just passionate about. I just can't let this continue to go on the way it is. We're wasting money. We're wasting time. We have to do something about this. Figure out what it's going to take to push that thing forward. I've done that countless times. Mike, I'm sure you've got your own examples of that.
Yeah, I think persistency is, again, I think people will assess your persistency. I just heard it the other day. It's still going to take you 7 to 11 efforts of communication to garner somebody's attention. Once I have that attention, I think persistency to me goes back to the things Al was saying for certain, but also the 10%. Let's remind each other why we're here. Even you'll get to the stage Al and I talked about the other day, competing priorities. Well, we've decided that we're going to invest in the parking lot. I come back to what the 10% was. What we decided was this would save $1.5 million. It has a direct effect on patient care and quality, and it's a competitive advantage for you. Does that parking lot do that? That's the persistency that I'm going to keep coming back to in terms of agreeing to the value that we agreed to moving forward. very, very key.
I think you guys said that quite well. Number 9, crucial, deliver what you sell.
It's pretty straightforward. The activity and your reputation and your credibility and your reference begins at PO. It begins when the order's cut. I can't tell you how many opportunities Al probably sold for me as a reference. And I always want to get to this spot with a client is don't listen to what I have to say, listen to what a user says. But that credibility and that persistence and that particular topic, it's what you do after PO that defines it. That's how I kind of view that perspective.
I want to take it one step further, not just to deliver what you said you were going to do, but to make sure that the people that you deliver to know that you delivered it. I always go back to an initiative that I sold at the executive level at Aurora, and working with the CFO and the CEO and the chief nurse executive, made a commitment to them, delivered on the commitment, scheduled a follow-up meeting to get in front of them and show them, look, here's what I committed to, here's what I delivered. And before I could even say it, they said it. What's next? What can we do now? Because you build on that success. So it's important that they know that you delivered. And like Mike said, you nail your credibility with these folks and you build on that over time. And it just gets to a point where what you propose is gold and people are more inclined to listen to it and move forward with it because you have delivered in the past.
I think a really often underestimated component of that is setting realistic or maybe even conservative outcomes around what it is that you're going to deliver. So we would call that under-promising and over-delivering. So that not only are you executing in the way that you said you're going to and you deliver the results, but you actually overperform on those results, which does nothing but build your brand so that they're even more prone to leaning in and saying, what are you going to do for us next? And then number 10, follow-up.
Talked about this a little bit, but follow-up to me comes in a lot of different flavors. It can be, hey, Al, how's it going? Did you get the proposal that I had someone was supposed to send over to you? Did we address the service contract circumstance that you had? It can be, and this is a challenging one today, walking, quote unquote, walking the halls in COVID time. I did so much follow-up walking the halls and maybe not even saw Al, or the executive team never even saw me, but they heard that I was there. They heard that I had stopped by the ICU to look at the monitor in bed 16 or whatever. And then I think follow-up is your credibility as a person. It's your reputation. Man, that guy follows up. I mean, when you hear that comment about somebody, that's probably the biggest compliment you can get in the world that we live in, regardless of what you're doing. Boy, do they follow up. And contrary, well, I never hear from them. I don't even know where they're at.
Yeah, that is rough.
That to me is a big deal.
Well, it's also a great opportunity. Like Mike said, it comes in a lot of different flavors. One of those flavors is summarizing the initial meeting that you had with that person, outlining what both of your accountabilities are and reminding them of that. Please tell me if I've missed anything or I got this wrong. Now you've really sent them a statement that, okay, these are the things that you agreed to and that you need to follow up on.
It's a great way of putting a period at the end of the sentence for the initiative that you've effectively sold internally. Wouldn't mind wrapping things up, but prior to you doing that, Mike, it's been an absolute pleasure. Thank you for the time that you've invested with us today.
Thank you. I really appreciate it.
I just want to express just incredibly important this topic is for everyone, even the customers that we have that work in healthcare technology management and healthcare facilities management. You're going to be selling all day long. Get good at it because it's really what's going to help drive things forward within your organization and raise your level of visibility within your organization.
Great wrap up. Thank you, Al. As usual, if there are any ideas for any other topics that we should cover on our next episode, feel free to let us know. We'll talk to you next time.
Thank you, Al, Mike, and Mike. This concludes episode 4 of Podcast on TechNation. If you enjoyed today's episode, you might also enjoy our ongoing webinar series, Webinar Wednesday. You can find a calendar of upcoming live webinars, as well as an archive of on-demand webinars at WebinarWednesday.live. To obtain your certificate for 1 CE credit from the ACI, please remember to click the link located below this podcast title to complete today's survey. If you have any questions, you can reach us at webinars@mdpublishing.com.